Hello, I'm Dr. Haft. Thank you for opening this video. I've been a primary care doctor for several decades. I'm also trained in infectious diseases. I love what I do. My patients trust me for my medical knowledge, and together we make the best decisions for their health. I want to talk with you today about COVID-19 and the vaccine. Please know I don't work for any drug company or government. What I'm sharing with you now is my own understanding of the situation and what I'm talking about with my patients every day. It's hard to know sometimes what to believe about COVID-19. News sites, government agencies, scientists, family, friends, the internet. There's a lot of information, a lot of disagreement, a lot of beliefs. I want to step back from it all and talk about what's best for you. First, I want you to know this virus is real. It is real, and it's a very tough enemy. It's invisible. You can't see it. You can't see it. You can only see what it does to people. You can't see it move from person to person. And that makes it hard to believe. And how could someone we love or trust be a threat to us? That doesn't make sense. And our nose and mouth, they're for smelling, eating, talking, breathing. Unless you always wanted to wear a hazmat suit or a muzzle, I figure you don't, then how can you accept wearing a mask over your nose and mouth all the time or be told that you have to? It can feel like you're being suffocated. I understand this. My job as a primary care doctor is to figure out the right choices for my patients. Knowledge is power, so I want to empower you. So let's talk about a couple things. First, the coronavirus's goal is to infect every human on Earth, all 7 billion of us. That's its goal. It's not going to change its mind. In fact, it will keep trying to do a better job. That's why there's now a mutant that's more infectious. It lives in the nose and throat. So when we talk, sing, eat, sneeze, cough, or just breathe, it flies out in tiny droplets so small they float up to 6 feet. Invisible to us, but this is happening all the time. One person will infect 3 other people. So one person will give it to 3, will give it to 9, will give it to 27, to 81, to 243, and so on. You see how we went from a few people in China to the whole planet. About 2 in every 5 infected persons have no symptoms at all, but they can still infect others. A healthy-looking person can pass the virus on to you. You can feel fine, yet be infected and pass it to 3 other people. This is also hard to believe. You wouldn't harm someone intentionally, but this really happens all the time. And if you get infected with COVID-19, you'll probably live, but you might die. You're more likely to get really sick or die if you're over 65, or you have obesity, sugar diabetes, sickle cell, chronic lung, heart, or kidney disease, or cancer. But you might be young and healthy, and you could still die of COVID-19. And now we've lost over 350,000 people. That's 1 in every 1,000 persons in this country, and it's going up. And I'm very worried about the next few months. Finally, I want to tell you, I've been taking care of people who died from COVID-19. I was by their bedside. Their loved ones couldn't be there beside them, and they left them behind. It was terrible, really heartbreaking. So what can we do? There are just 2 ways to change what's happening. 1, we stop the virus from moving from person to person. 2, we make anyone who encounters it strong enough to resist it. The first way, If every person was over 6 feet from every other person all the time, no problem. But that's not likely how you live. Sometimes you need to be with others. Most of us do. So there's one thing we can do: put a barrier between the mouth and nose and others and keep it there. It's hardest for many of us to cover our noses. It doesn't feel great, yet that's where the virus will enter, flourish, exit. And if we take a break, we just slip our mask down to eat something, for example, we just give our nose a little air. This is wonderful for the virus. It just needs one instant to make its invisible move. I need to add that our hands can also carry the virus, and we can touch our mouth and noses without realizing we're doing it and infect ourselves. So hand washing is so important. And masks don't work 100% of the time. But if I told you that you had a 95% chance of winning something you wanted, wouldn't that be great? And the second, making the next person to meet this virus powerful enough to resist it, that's what a vaccine does. I want to talk with you about vaccines because this is our way out. What does a vaccine actually do? It's a treatment that makes your body believe that you're infected with a germ when you aren't. It puts your immune system through disaster training. You may say, I don't want my body tricked into anything. I hear you. But may I ask you, have you had polio, measles, mumps, tetanus, whooping cough, diphtheria? No? Do you know a lot of people who've had these diseases? No? Your great-grandparents, they got these diseases all the time, and they all knew people, grown-ups and children, who died of them, or lost their hearing, or could never walk again, or could never become parents as a result. It was natural, but it was terrible. So why haven't you had any of these diseases? You were vaccinated, as was most everyone around you. It's amazing that there are already vaccines for COVID-19. If you felt bad about the last year, well, I feel joy about this amazing national achievement. And the support came from all sides: the White House, the Operation Warp Speed team, Congress, government agencies like the NIH, the CDC, the drug and vaccine companies, the volunteers who took the vaccine. Everyone did the right thing here because this is our way out. I really want you to get this protection. The chance you will get a bad case of COVID-19, go into the hospital, maybe even die, goes down dramatically when you get the vaccine. There are a few last things I want you to know. 1, vaccine can make you feel ill. A lot of people who volunteered to take the vaccine did report this. Please expect this to happen, but don't let it stop you. I don't want you to feel unwell, but this is how your body is responding. When a superhero first gets a superpower, they feel it. It doesn't feel good, but this is what it's like to get your superpower. 2, have you ever had a severe reaction to an injection right after getting it? You couldn't breathe, you had to go to the emergency room. You might have the same reaction to the COVID-19 vaccine. If so, talk to the person offering you the shot and decide together what to do. Fortunately, this is a really rare event, and everybody should be watched for at least 15 minutes after getting the vaccine. 3, it's going to take a few weeks to work fully. Some of the vaccines are 2 shots, 3 or 4 weeks apart. Even then, the protection is not 100%. Your mask is still very important, and it will be until the infection rate is way down. We're all going to take our masks off together when COVID-19 is defeated. 4, Many of my patients are asking me which vaccine to take. I don't care so much about this. The big difference is between getting it and not. They all protect you. So please accept the first one you can get. And please, please do not wait. 5, some people are worried that this vaccine, something that's never been around before, can affect them in an adverse way, can mark them, or can inject something that's used to control them. I can understand some of these feelings. This is something new for all of us. But I hope that you will trust me and trust the good people who did all this work to try to save lives and end the pandemic. And finally, this is a really hard one. There are going to be people who get the vaccine on a Monday and have a stroke on a Thursday, or come down with cancer 3 months later. And of course, they're going to believe that the shot caused their stroke or gave them cancer. It makes perfect sense to them. But I want you to know bad coincidences are going to happen. How are we going to figure things out? If, heaven forbid, something bad happens, we have to hear about it and report it and figure out, is there an increase in the incidence, or is it what we expected? I'm asking all my patients to let me know if there's anything that happens to them after they get the vaccine. When you get your vaccine, please make sure they tell you whom to contact for any symptoms. Thank you for letting me share this information with you today. If you've lost someone to COVID-19 that you cared about, I am so sorry. Maybe I was standing by their bedside. I have to think they wanted you to do everything you could to be okay. So please, wash hands, mask over nose and mouth. Please accept the vaccine as soon as you can get it so we can all live our best lives. I wish you all the best.